any treatment for ringing in the ears? So this is a common one. A common question that we get a lot is tinnitus or ringing in the ears. The biggest thing that I focus on right away is trying to figure out why you have ringing, right? So I'll typically send somebody that has tinnitus. I'll send them to an audiologist or ENT, ear, nose, throat doctor, to try and find out if there's something else going on or some cause for it. If it ends up being benign or there's no specific cause to it, like I want to rule out things like Meniere's disease and other pathologies. But if it comes back that there's really no specific cause, there's a few things that can cause ringing in the ears that are, I don't want to say treatable because there's not really a lot of evidence to support it, but anecdotally with some of my patients, we have been able to relieve the ringing in their ears with certain techniques. So the eustachian tube opens up from your throat into the inner part of your ear, and if there's a buildup of pressure in there, that can cause ringing in the ears. It can also feel like a fullness in the ears, and oftentimes if we do work on the neck where that tube connects through, because it connects through the soft tissues and stuff of your neck, if your neck is super tight, which it often is after concussion injury, that can collapse that and prevent, proper drainage and things. And so there's things you can do working around there that might have an effect on ringing in the ears. If that doesn't work, then there's really not a lot of treatment options for it, unfortunately. So I would say if you do have it, first find out the cause, rule out any of the bad stuff that could possibly be going on, see an ENT, talk to your doctor about any type of referral, and if there's nothing there, then maybe see a chiropractor, physio, osteopath, somebody that can either work on draining that eustachian tube. So there's a technique called the Muncie technique where you put your finger in and you actually open up, you put pressure on the opening of the eustachian tube to allow for drainage, or even just working on the soft tissues, or even some adjustments of the upper neck sometimes can just open that up. And I've had patients where it's worked, and I have other patients where it doesn't work. And unfortunately, if it doesn't work, I'm pretty much at a loss for that issue. So first, find out the cause.